Hi, Laura here. So just going to show you some self-care colon hand reflexology. So the colon is obviously the large intestine. It's where our stools are formed, where the last bit of nutrients are absorbed from the body, and all of our waste then obviously goes to then be eliminated. And so a lot of people do suffer with various different colon imbalances. Obviously a common one being things like constipation, etc. And so there is a really good hand reflexology sort of tip. Now, obviously, as I'm sort of standing here and you're looking at the camera, these are probably opposite way round to facing you. So this is my right hand and this is my left hand. So I'm sort of standing in front of you. So as you're facing me, my right hand would look like your left and my left would look like your right. So just bear that in mind. So obviously it would help if you're comfortable with your left and your right. I know that for some people it's a little bit more tricky. So if you, for instance, a lot of people most commonly wear their watches on their left wrist. So obviously the hand that your watch is sort of worn on is your left, and your right not so much. So we're going to start off with our right hand. So the hand that we don't have our watch, or maybe wedding bands are traditionally on the left hand as well. So it's kind of like the non-traditional sort of wedding band hand. So what we're going to do is we're going to start in line with our fourth finger. So this is known as our fourth zone. And this is the heel of the hand here. So we're just going to start maybe a little bit above. So in line with that fourth finger, just where that sort of nice squashy bit starts, and we can just use our thumb or our finger and we can just gently press and rotate. And so this is kind of our appendix area, our ileocecal valve. So that's the valve that passes the food between the small intestine then onto the large intestine. And then what we're going to do is we're just going to walk up in a straight line up the ascending colon. And because everything in the hand is very squashed compared to the torso, and also if we're doing foot reflexology, we literally only go up maybe about a centimetre or two. Now my hands aren't the largest hands, so obviously if you've got bigger hands you go up a little bit bigger, but the more you practice the more you tend to feel where the right point is to stop. It sounds weird and you can't really explain it, it's just a feeling or a knowing. So the more familiar you get with the body, the more that you'll be aware. So at that point we're going to twist our thumb around and we're going to travel from here across to about, if you think about the base of our thumb here, our wrist, to about the halfway point. So we're going to travel, so I'm going to backwards caterpillar walk so you can see. So caterpillar walk is just press and hold, move, press and hold, move, press and hold, move. So we're just gradually gliding across. Okay. So it is kind of like a sideways L shape that we're making until we get right to that corner there. Again, approximately halfway between the base of your thumb and obviously the base of your hand here. So we've literally travelled from this point up and across. So up and across. It's kind of a slight diagonal really. And so that is all you need to do on your right hand, your non-ring finger hand, you know, your non-wedding band hand, okay? So up and across, up and across. And then we're going to continue because this represents half of the body. So this will represent the right hand side of your body. And the colon is found on the right and the left hand side of the body. So it makes sense that the colon continues onto your ring finger hand. So what we have actually done is gone up our ascending across half of our transverse, so we need to continue across the transverse. So we're going to find our way about halfway between the base of the thumb and the base of the hand, and we're going to continue that journey across the transverse part of our colon until we get in line with that fourth finger, the same, and then we're going to travel down. So then we're going to travel down the descending until we get to about that same point again, and then this time it's going to actually make a funny V shape because we've got our sigmoid colon. So we're actually going to travel back from our fourth zone towards our thumb, but it's going to be and finish right at the base because that's basically our anus and rectum. So we're going to travel along that transverse colon, continuing off from the right hand, so along where sort of your wedding band would be if you're married, or where somebody's wedding band would be on your left hand. Then travel down the descending colon, and then we're going to make this sort of V shape, so kind of dip in the centre here and then continue to walk across to about here. So again, caterpillar walking across, gliding down the descending until about here, and then making that nice sort of V shape for the sigmoid to the anus and rectum there. So that is the colon. So up, across, down, V. And so that is the approximate sort of shape of your, everybody's hands are different shapes, different lengths, different widths, so you have to accommodate for that. So it is very much an intuitive thing as well as an actual sort of practical sort of pinpoint. So it might not look exactly the same, but it might feel right. For people that are very congested, then you can start backwards. So you can start from the sigmoid colon, so this V, so you can go across the V and you can glide or caterpillar walk across in that V shape to try and clear this congestion. We still want it to travel in that same direction. We don't want it to go backwards because that's going to make you more congested. And then you could travel down the descending and then across the sigmoid. And then we could travel across the transverse, down the descending and across the sigmoid that way. So we're trying to clear the congestion before we force any more stool through. So trying to clear the blockage before we push any more alongside the colon, so you can do it that way. And then the same with the right hand, so the non-traditional watch or ring finger hand, wedding band hand. You would then just go across the transverse first a couple of times there. You can spend as long as you want on this, 5-10 minutes purely on the colon, and then you could go up the ascending and then across the transverse that way. I always get my descending and ascending mixed up, so I apologise. So then by that point we should have cleared the sigmoid first, then pushed any remaining stool down the descending into the sigmoid, and then across the transverse, down the descending sigmoid, across the transverse, and then up the ascending across the transverse. So it's clearing it sort of back to front, but we're still going in this clockwise direction, which is the way that the stools travel. So I hope that you found that helpful, and please comment, like, subscribe. Anybody that does have any sort of severe medical conditions, particularly sort of the big one being any deep vein thrombosis or embolisms, or any serious heart conditions, or anything that might make you question whether reflexology is safe for you. Obviously I've not done a consultation. Please consult your doctor, your GP first, or at the very least maybe reach out to a local reflexologist to you. But I hope you found this gentle technique helpful, and it can be used on babies, adults alike, so any age. So thank you for watching. I'm Laura Waldridge of Angelwood Therapies, and I'll see you soon in the next video.